Welcome to The Explainer. The role of a healthcare administrator, it's going through this massive revolution. We're not talking about just managing paperwork anymore. Nope, it's about actually architecting the future of patient care. So today, we're going to break down Dr. Angela Maxine Robinson's incredible guide on how AI and new tech are right at the heart of this huge shift. And this right here, this quote from Dr. Robinson, it pretty much sums up the whole story. The job has had a seismic shift. It's not just about clerical stuff anymore. Now it's about strategy, it's about ethics, and really the deeply human side of medicine.
All right, first up, admin as system architect. So what is this big shift from just a support role to a really strategic one? What does that actually look like in practice? Let's get into it.
Okay, so check this out. This really gets to the heart of the change. Back then, the focus was all on executing these little individual tasks, right? Filing forms, managing schedules, just ticking boxes. But now, the focus is on designing the entire system. Today's admins aren't just cogs in the machine anymore. They're the ones building the machine itself, the workflows, the tech, the whole ecosystem where patient care actually happens.
And look, this isn't just some abstract theory. This is real-world stuff. Take Nakuru County Referral Hospital. One single administrator there managed to cut patient wait times by a staggering 40%. And how'd they do it? It wasn't by just messing with the schedules. Nope, they started thinking like an architect. They mapped out the entire patient journey, used data to find the exact bottlenecks, and then literally redesigned the whole system from scratch. Amazing. All right, so to be a system architect, you obviously need the right tools for the job. And that brings us to our next section, mastering the digital system that makes this whole new strategic role even possible.
So let's talk about the EMR, the electronic medical record. I want you to think of it as the hospital's digital nervous system. Seriously, it's so much more than a digital filing cabinet. It's the connective tissue that links every single department, that keeps an eye on compliance, and that feeds data into basically every clinical decision. For a modern admin, you gotta be fluent in this. It's absolutely non-negotiable.
And this is where AI comes in and just supercharges the whole thing. It acts like a massive amplifier. It takes all that data from the EMR and turns it into smart, proactive actions. So now, you're not just reacting when the waiting room gets full. Predictive analytics lets you see it coming. You're not just waiting around for an audit to find a mistake. An automated alert flags it for you in real time. See, that's how raw data transforms into real strategy. But of course, all this amazing technology doesn't just exist in a bubble. It has to operate within this really complex web of rules. And that brings us to Section 3, navigating Kenya's compliance engine, things like the ISAA and NHIF frameworks. And, for administrators, getting a handle on these policies from the Social Health Authority and the National Health Insurance Fund, it's not just about avoiding penalties. It's about speaking a whole new strategic language. Being fluent in compliance, that's what secures the hospital's funding. It's what builds trust with the public, and honestly, it's what ultimately decides if the hospital sinks or swims.
Okay, let's play this out. Picture this. You're in a super high-stakes job interview, and they hit you with this question. An audit just flagged a critical compliance breach. What do you do? Whoa, all eyes are on you, right? They're not just testing what you know, they're testing how you lead when the pressure is on. So, what's your move?
Well, Dr. Robinson's book lays out this brilliant, structured approach called the STAR method. And this is pure gold. It's how you take a potential crisis and turn it into this compelling story of your leadership. You just walk him through it. Here was the situation, this was my task, these are the actions I took, and here's the quantifiable result. When you do that, you're not just proving you can fix a problem. You're showing them you can build better, stronger systems. Okay. So let's recap. We've got the systems, we've got the data, we've got the rules. But what happens when all of that stuff conflicts? And that brings us to our final section, and maybe the most important skill of all, the one thing technology just can't replicate, and that's human judgment. Think about it. An AI can process 1 million data points in a second and find a pattern. That's incredible. But what it can't do is understand the nuance of a patient's fear. It can't grasp cultural context or navigate a tricky ethical gray area. And that's exactly where the modern admin steps in. They have to be the ethical gatekeeper, making sure that the tech is always serving the patient, not just making the system more efficient.
And this isn't some sci-fi scenario. This is the new reality playing out on hospital floors. An AI tool, looking at all the efficiency data, recommends discharging a patient.
But the clinician, using their years of hard-won experience, completely disagrees. And you? You're the administrator stuck right in the middle. So, what's your role here? Which side do you take?
The answer, and this is so important, is that the AI is just a tool. It's not the final verdict. Your role as the administrator isn't to just blindly enforce what the algorithm says. It's to facilitate that conversation, to support human judgment, and to make absolutely sure that the final decision puts patient safety first, period. Technology gives us input, for sure, but the humans, we have to have the final say.
So there you have it. This is the new reality. The modern healthcare administrator isn't a clerk anymore. They're an architect of the future. And as Dr. Robinson's work makes so clear, that next job interview, it's not just a test, it's a launch pad. So the real question to leave you with is, what are you going to build?